everyone, I'm Wahanya Doc. In this video, I'm going to discuss asthma. If you like and benefit from this video, hit the like button, comment below, share, and most important, subscribe. What is asthma? Asthma is a long-term condition in which your airways narrow, swell, and produce excessive mucus. The narrowing and the swelling of the airways will make the airway lumen diameter small, and also the excess production that is occurring within the bronchus of your mucus will worsen the airflow, resulting to airflow obstruction or difficulty in breathing. Asthma can be fatal, and asthma is very common. There are millions of more than 50 million people who have asthma in the world. Asthma will have the following symptoms. We have a cough, wheezing, shortness of breath, chest tightness, chest pain, and also in severe cases, patient will also have a respiratory distress. Respiratory distress is where the patient will have nasal flaring. Flaring of the nose is where there is widening of the nostrils when one is trying to breathe in. And also, the patient might have what we call chest wall indrawing. Chest wall indrawing is where the space around the neck and also in the ribs that area is sinking in when one is trying to breathe in. Those are the signs and symptoms of asthma. Let's see a structure here of this diagram of the tracheobronchial tree. This is the structure of airway. We have the tracheobronchial tree. The tracheobronchial tree is the functional and structural segment that transmits air or allow passage of air from the upper respiratory tract into the lungs. This is the trachea and the bronchus. That's what we are calling the tracheobronchial tree. We have the upper airway. Upper air constitutes of the nose passage, the throat, and also the larynx or the voice box. Then we have the trachea. Then we have the right and left bronchus. The right and left bronchus usually has multiple divisions. Those multiple divisions will form the bronchioles. Bronchioles will form in thousands. The bronchioles will form respiratory bronchioles or tertiary bronchioles. Then tertiary bronchioles will connect to air sacs or alveolar. From alveolar, the air will enter into the bloodstream. So the bronchus has a wall. This is a bronchial wall. I've zoomed a small segment of the bronchus of the small bronchioles. This wall has 4 layers. We have the most inside part, which is the mucosa. Mucosa is made up of epithelial goblet cells. Goblet cells produce mucus. Their function is to produce mucus. In asthma, these goblet cells will produce excessive mucus. This mucus will clog and block this part, which is the lumen. The lumen is the hollow part of the bronchus. Then we have the second layer, which is called the lamina propria. It's the second innermost layer. We have the third layer, which contains the smooth muscles. It's called the submucosa. This layer in red. Smooth muscles they have a function. Their function is to dilate or to constrict, increasing the diameter or reducing the diameter of airway. When the smooth muscles dilate, the lumen or the hollow part of the bronchus increase in diameter. This is especially when you are exercising. You need more air to flow into your lungs, so the airway has to have more diameter to increase the air demand. When we don't need a lot of air, this smooth muscle cell will constrict, reducing the diameter of the lumen. When you have asthma or in an asthmatic patient, these smooth muscle cells will contract in excess, reducing the airway into a very small diameter. This will result in those symptoms of asthma or difficulty in breathing or a wheeze. Then we have the outermost layer, which is called the connective tissue. In asthma, these four layers become inflamed. Inflammation means these four layers will swell. When these four layers will swell, they will also contribute to the reduction of the airway diameter. How does asthma occur? Patients or individuals who have genetic risk factors and environmental triggers, when they breathe in air that contains allergens like dust, pollen, cold, strong smells like perfumes. This air will enter into the airway, then it will come into the trachea, then it will come into the bronchus and the small bronchus or the bronchioles. These airways or the bronchus usually contain immune system cells. Their work is to defend your respiratory system from foreign substances. So these immune system cells will swallow those allergens or those dust. When they swallow those allergens, because those allergens are foreign substances, these immune cells will overreact to these harmless allergens. They will usually recognize them as they are very, very harmful. Through compressed interaction, these cells will interact with other immune cells to produce chemicals like histamine, we have prostaglandins, we have leukotrienes and interleukins. These inflammatory chemicals or these chemicals will result in whatever we are saying. They will make the bronchus to swell. They'll also make the inner lining with the goblet cells to produce a lot of mucus. They will also make the smooth muscle cells to constrict excessively. That's how those are the three features of asthma. What are the causes of asthma? There is no known cause of asthma. What we have is that we have the genetic factors, a combination of genetic factors and environmental triggers that can contribute to an individual having an asthmatic attack or asthma. The genetic factors include one, we have family history. If you have a parent or a sibling who is asthmatic or a blood relative, there are chances that you might also develop asthma. Number two, we have what we call atopic triad or atopic history. Atopic triad consists of three things. We have asthma itself, we have allergic rhinitis, and we have allergic dermatitis or eczema. Patients who have allergic rhinitis or eczema, they have high chances or high risk of developing asthma. Allergic rhinitis is the inflammation of the nose membranes, the membranes that line the inner side of the nose. This allergic rhinitis is caused by the overreaction of your immune system to allergens. Allergens are harmless substances that have a probability to cause an allergy or an allergic reaction. Your body usually mistake these allergens to be what we can say as a harmful substance, and your immune system will overreact by producing chemicals that will try to destroy these allergens. Eczema or allergic dermatitis is an allergic skin condition in which the skin becomes dry, and also it becomes itchy and bumpy. So patients who have these two conditions have higher chances of developing asthma. We also have another thing we call Sumpter thread. Sumpter thread consists of nasal polyps, and also it also contains of aspirin sensitivity and asthma. Nasal polyps are soft, non-cancerous growth that are painless, that are found within your nose cavity. We also have aspirin sensitivity. Individuals with an allergy to aspirin or other painkillers like brufen may have higher chances of developing an asthmatic attack if they are given a single dose of aspirin. And we also said we have those factors that are environmental, or those environmental triggers that can result to an individual developing an asthma. These these environmental triggers, we have one, environmental allergens. We have said allergens are substances, harmless substances that have a potential of resulting to an allergic reaction when your body recognizes them as very harmful and overreact. Allergens that can make patients to develop asthma, we have cold or cold air. Number two, we have pollen. Pollen is produced when plants are flowering. Number three, we have dust. Fine dust, especially when you are trying to clean the house or you are trying to do an activity that will expose you to fine dust, like that dust that comes from woodwork. These dust may trigger an asthmatic attack. We also have dust mites. Dust mites are microscopic insects that usually feed on the dead skin cells. These dust mites usually hide within your pillows, beddings, mattresses, and within the furniture in your house. So those patients that have asthma, they usually can have an asthmatic attack if they inhale those dust mites. Another allergen, we have animal dander or pet dander. Pets like cats, dogs usually shed off what we call the fruits. These fruits are like how humans have dandruffs. So if you breathe in this animal dander, that one may make you develop asthma. And also another allergen is what we call the cockroaches. Cockroaches are a very common cause of allergic or asthmatic attack in urban centers. Number two, we have environmental irritants. Environmental irritants include strong perfumes, and also we have paints, strong fumes from paints. We also have environmental pollutants. This is tobacco smoke. Tobacco smoke is a trigger for asthma. And also we have exercise. Those people, there are people who, when they exercise or they have what we call a vigorous physical activity, they can develop an exercise-induced asthma. This vigorous physical activity may also include having sexual intercourse. And also we have emotions, emotional factors and stress. Emotional factors like fear, anxiety, and strong emotions can result to having to develop asthma or having an asthmatic attack. That's explain why sometimes when students are nearing to do exams, because of that anxiety, most students who are asthmatic usually develop asthmatic attack. Also, we have conditions. There are those diseases like viral upper respiratory tract infections. Evidence shows that if you have a rhinovirus infection or common cold, you have high chances of developing asthma later in life. And also, viral infections are a trigger factor to an asthmatic attack. We have another condition we call sinusitis. Sinusitis is the inflammation of the paranasal sinuses. Your skull usually have hollow spaces. Those spaces have a lining, a membrane. When that membrane can swell, 50% of the patients that have asthma, most of them also contain this condition we call sinusitis. We also have another condition we call GERD or GERD. GERD is gastroesophageal reflux disease. This is a digestive system disorder whereby the stomach acid or other contents of the stomach build up and send into the food pipe and also up to the level where they reach the airway. People who have GERD has shown to be causing asthma in 64% of the patients. And also we have other issues like obesity. Children who have excessive weight gain, or children who usually gain a lot of weight during childhood or infancy, have a higher chances of developing asthma symptoms. And also we have what we call hygiene hypothesis. Hygiene hypothesis is a usually says that if a child is too much hygienic, this child is not exposed to a lot of bacteria, and also this child is not also exposed to environment. These people usually develop asthma later in life because of the delayed maturity of the immune system. Those are the risk factors of developing asthma. Asthma can be fatal. Asthma is a very serious disease, especially when you get an asthmatic attack. So watch part 2, where I'll be discussing the complications of asthma and the treatment of asthma and how asthma is classified, because you can find some patients say that they are not asthmatic, but maybe just because that your classification is mild. So follow and subscribe to Ahinya Doc for more content like this. Thank you.